Hey guys, this is Dr. Lamb talking to you about stem cell therapy. Started stem cell in Naples, Florida about 2 years ago. And I have to say we have some amazing results. So amazing that we have competitors in the market trying to come in with their own products, which is perfectly fine. I know that I was the original one that started with a live amniotic stem cell injection, and we still have the highest quality live amniotic stem cell product. Amniotic, not embryonic, which are from fetal tissue. This is amniotic from the amniotic membrane, amniotic sac, and amniotic fluid. Most common question from patients: where do you get this from? Well, this is from a FDA-approved laboratory where they have screened the donors, the mothers from live birth for diseases, as well as when they harvest it, they make sure there's no substance that can cause an allergic reaction for our patients. So it's a safe product. It's a great product for our patients for joint rejuvenation of the knee joint, ankle, hip, and they've been using this for the back. Obviously, we don't inject the back in this office, but we do have consultants that do that. So we also offer currently also have the stem cell derived from the bone marrow. We also have that available. Now, there's many different systems out there. There are those that have centrifuge systems. You take 60 cc's of blood, you spin it down to have anywhere from 6 to 8 cc's of stem cells. Hard to quantify those. You look at all kinds of studies, and obviously every company has their best studies out there to say that they are the best. Now, the one that we use is one that have been proven through clinical studies that has gives one of the best results. These mesenchymal stem cells from the bone marrow. These systems allow us to tap the tibia, which is the leg bone, or the calcaneus, or the heel bone, to draw out the stem cells from there and to not have a lot of peripheral blood contamination. That 60 cc sounds great, but the problem is you're taking a lot of peripheral blood along with it. Whereas for me, our system, we are only drawing the mesenchymal stem cells through this patented system, and we're using that live stem cell from your own bone marrow, injecting it into the joints, the tendons, ligaments, etc., to help you heal. Some of my patients call it the fountain of youth. That's people have been suffering for a long time with knee pain, Achilles tendon rupture, or joint pain. See for yourself. These are actual patient interviews when they come in. Again, some patients refer to these as a fountain of youth. This has worked out great for a lot of our patients. See for yourself, and proof is in the pudding. A few months apart. Few stem cells injections. There's a knee arthritis. Few months apart. There's no crunching in here anymore. You're able to do your activity, and this feels really good. You're not able to do this before, right? So how much pain do you have before this?
I would say around 5.
5?
Yeah.
Unable to do your activity and everything. I remember it was crunchy and everything. Last one I gave you was a little while ago, right?
I don't know. It was.
Yeah. No, but it feels really good. You're able to do activity, walk up and down the stairs, no problem.
I'm doing 4 miles a day in the bicycle to 5.
Good.
5 days a week.
Continue doing that. That's still gonna keep on going.
And also the weights, and I also all the exercises at home
For
when
the
I sit
arthritis,
down, and I sit every night.
Awesome.
Always, yeah.
No, you're doing really good. The swelling's very minimal to hardly any. Your movement is very smooth, and it's not ending right here. It's not hurting.
No.
I'm pushing pretty hard right here. So I'm very happy with that, my friend.
Yeah.
Let's keep up. We're just gonna do a 9-month follow-up. That's it. You're gonna do great. Continue building, okay?
Okay, so with the exercise, building up, right?
You're doing great. You're doing better every time I see you, my friend. We did them in two separate times.
Yes.
We did 1 cc and 1 cc. We hit it, and you're doing excellent. Okay. You recommend other people when they have arthritis, right? Before they do surgery. This is great.
Yes.
So we did the amniotic injection ×2 in the knee. She's doing great. You happy with that?
Yes, I am.
I'm very happy with your results.
In the morning when I start my exercises, start crunching a little bit, but as I go,
Gone, right?
gone.
Yeah, you're very active. I was watching you walk in, and this is doing really good.
Yeah.
Congratulations. And this one was all right.
Yeah.
Good. Then we'll see you back in 9 months. We'll go from there. I'm glad
Okay.
you're doing very well.
Okay.
I'm testing it out. Female here. We had a lot of knee pain on the right. Am I correct?
Right.
It was almost disabling when you came in. How much pain did you have when you came in here?
On a scale of 1 to 10, I'd say about 7.5.
7.5.
Yeah.
And then we came in, you inquired about the stem cell. I gave you a stem cell injection in there about November, we say.
Yes.
And now we're towards the middle of January.
Yes.
How long did it take for the stem cell to take effect on you?
I'd say a little over a month.
Okay, over a month. That's what we expected. So, how much pain do you have in there right now when you walk?
Just no pain at all when I walk.
So you're happy with it? The results after that 1 month?
I'm happy.
Right?
Yeah, I am. I'm very, very happy. Okay.
Okay, well, I mean, it feels really good, and you're able to do all your activities and walk around. And
I don't do any deep knee bends anymore. I think I wanted to say maybe that aggravated it.
You can, but for your regular activities right now, you're perfectly fine without any
Okay.
problem, no pain. Am I correct? Or
Right.
you were pretty high on the pain scale when I first met you.
That's right.
Okay. Was there any pain with the injection itself when I gave you the stem cell
No.
injection? So it was fairly painless then.
Yeah. Mm-hmm.
Would you recommend that for other people with the same knee arthritis?
Absolutely. Absolutely.
Yeah, we rejuvenated your joint. I'm glad you're feeling well. There's not much swelling in here to go on with life. And you just let me know when you need me for anything. I'm glad you're doing very well. At 87 years young, stay active, okay?
I try.
Well, this helps you. You don't have to worry about knee pain anymore,
No,
right?
I know. That's a big item.
That's a big item. Well, I'm glad to be able to help on that. You've done really well.
Okay, well, you come highly recommended, and I would highly recommend you too.
Well, thank you. You've been awesome, my dear.
Okay,
Okay.
Gary, thank you so much.
Thank you.
As you can see, the video showed you the patient interview after stem cell therapy. You could see that the patient have done really well. They were slated for knee surgery, but instead decided to use stem cell therapy. Stem cell therapy is utilizing pluripotent, or means it can change into different kinds of cells. So we inject it into a diseased joint or tendon. It actually helps it to heal the joint, decrease pain, decrease inflammation, and give you some life in that joint. So before you ever think about the complications or potential complications associated with knee surgery, knee replacement, stem cell therapy is definitely a great way to go. As well as tendinopathy, Achilles tendon tears, or any kind of tendon tears about the front ankle or lower extremity, the stem cell has the potential of helping you with your pain. Visit us at naples.podiatrist.com as well as topstemcell.com, topstemcell.com for more information. We do amniotic as well as bone marrow aspirate stem cells, and you'll get the top quality care and the best stem cell therapy available.